All right, my people. Hello, hello, and I apologize for whatever it is. These things happen, but let me say welcome to Spoon Talk Business right here. 1 hour of discussion where it comes to brands and business people, investment, technology, workshops, seminars, church programs, whatever it is. People come here to talk about their businesses, and the businesses do go viral. And let me say welcome to the show. Our hosts have been seated, and we apologize for the few minutes delayed. You precious people of Liberia, we know that you people love the program. You are there in the diaspora, you're here in Liberia, you want to see what is happening. We welcome you. Thank you for being there. And let me just quickly bring on your host. But today we're gonna have a whole medical team. They're gonna be discussing everything where it concerns mental health, tuberculosis, and all of those things that you need to know. Your health is your wealth, and they come from Carter Center and other partners. And our host, CEO Titi Kane, and of course, Dr. Francine Chenoweth Richardson are going to quiz them, listen to what they have to say, and we are also going to engage with the public. So I say welcome. My name is Lorena Honoré. Of course, I am your producer. So let me bring in the host, CEO Titi Kane. Welcome. Madam Kane, we say welcome. Welcome. How are you?
Fine, thank you.
All right, and there's Dr. Richardson, and let's welcome both ladies who already have in studio some of your guests. How y'all doing?
I'm
Miss D,
doing
how you?
well.
I'm fine, Dr. Richardson. How you doing? I love those glasses, girl.
All right.
Thank you. I'm doing well. I'm doing well. I had a late night last night teaching, so I'm wearing glasses today so I can see better.
That's all right.
Welcome. You both
Actually,
look.
these are prescription glasses, and I wear them. But
Oh,
it's
okay.
good to see Lorena. It's good to see you. I want to also tell everyone, if you just joining us, to please share this show. We're going to give you a few seconds to share this show. This is where you come to promote business in Liberia. We want to empower the business sector. So please go ahead and share the show. Put your radio on loud so that the people around you can enjoy the show. We are going to be discussing medical issues that are very, very concerning to Liberians. When you come on this show, you can get any kind of information that you want, be it medical, be it real estate, be it mechanic, be it farming. This is the place to be. So we want to tell you, thank you for joining us. Mr. Dick, over to you.
Yeah, and sorry for the show coming on late today. Technical glitches.
I tell you, that's it.
So sorry, but we are here all the same, and it's about tuberculosis. I know back in the day, what the other name for tuberculosis? They used to call
TB.
it white death.
Oh,
Yeah, historically known as consumption. Yeah, that's the big name that they have for it. But anyway, it's not as big as it used to be. It's not even as big as it is now. It is as small as this if you follow the advices from the medical people. And today we have in studio two strong women that will introduce themselves. They're here to kickstart this program. And then they will fade out, and then we'll bring another two in to talk about tuberculosis. It is not a death sentence. So, ladies, welcome to Spoon Talk Business.
Thank you.
And welcome to our studios. And please go ahead, introduce yourselves, and tell the people where you're sick.
Okay, so I'm Mona Bobler Johnson. I am a nurse and a TB clinician assigned from the Montserrat County Health Team at St. Joseph Kelly Hospital Chest Clinic. So at St. Joseph Kelly Hospital Chest Clinic, we provide TB services. So anyone who feels or they think they have issues with TB or the suspected case, they can walk to the hospital and then they are diagnosed, tested, and treated at the Kelly Hospital. So today we are here, we'll be talking about how to prevent TB. That is why we are on the show this evening. Over to my colleague.
Yes, thank you for the show. I'm Tracy TJ Kotime. I'm a TB clinician from the Redemption Hospital, where I serve as TB focused person. And today we'll be stressing on something we call TPT. Yeah, TB preventive therapy.
Okay.
How to prevent TB in the community.
Okay. So let's
So
kickstart this thing. How prevalent is it
Actually,
now?
Miss City, before we even kick
for
started,
TB
I just
now,
Hold on
Miss
1 minute.
I just want to just welcome you two beautiful women into the studio. I'm always happy when I can see women actively involved in Liberia's problem. So I want to just welcome you and my hats off to you for the work that you're doing in Liberia. So thank you for coming into Spoon and being a part of this conversation. So Miss T, I'm over to you. Go ahead and they can proceed.
Okay. So
Thank you, Ta.
thank you. So you're talking about the prevalence rate right now.
mhm.
So every 100,000 person, you have 360 person. Yeah,
Yes.
that will
Wow.
have. But for muscle rather now,
Mhm.
you will have a high prevalence rate because of the population that we have in Maserati compared to other counties. Yeah.
Wow.
Yeah.
So go
So
ahead. Go ahead. Jason.
so definitely, those statistics are correct, and Liberia is on a map for our issues with TB. And so I'm happy to know that you are working very hard to decrease the prevalence, the frequency of TB in our country. That's what you guys are here to talk about. Some of the strategies that you have been working on so that we won't have this high rates of TB in our country. So our country shouldn't be known for the frequency of TB among people. So let me hear some of your strategies that you guys are working on at the TB Center.
Yeah, one of the strategies we are working on comes from our partner from Cattle Center where the integration of TB integrated with mental health.
Mm-hmm.
We are now doing contact tracing to prevent TB. That's what we call the TPT, TB
Mm-hmm.
preventive therapy. It's a therapy now that we have just in country to prevent TB. So those people that have contact, for example, you have somebody that is positive from that household. So we go back to that household and trace those contacts,
Mm-hmm.
screen them, and those people that are responsible with the project, we call them CHW, go
Mm-hmm.
and screen those people. The ones that are presenting with signs, symptoms, collect their sputum. They
Mm-hmm.
rather take it to the facility. If the one that are not presenting, they will also be on the therapy that is the TPT to prevent the TB disease. Because that's what we want to prevent, the
Yes.
issue of the disease.
Yes. Yes.
Okay.
Thank you.
Can I just hold you 1 minute? We have the others.
In a pie.
If they're in the back, bring them on, Lorena. The
Okay.
bigger the party, the
Yeah.
merrier.
I'm bringing in Julius, Joe,
Okay.
and
So you can continue.
Justina.
Yeah,
Your
okay.
colleagues are coming
So
on already.
actually, this
Mm-hmm.
program, we are here to talk about tuberculosis preventive therapy.
Mm-hmm.
And we are working in partnership with Cattle Center. Cattle
Yes.
Center has been partnering with the government of Liberia through the Ministry of Health to aid the TB program because we have had lots of challenges. And for Liberia, Liberia is a hard-burning country with TB cases, especially for muscle rattle. So Cattle Center is partnering with us, wherein we are integrating mental health with TB because lots of times, especially with statistics that is available, they say 40 to 70% of those who come down with TB and are treated, they experience anxiety and depression. So Cattle Center is aiding us so that we'll be able to address the mental health issues of those who are in care. And besides addressing the mental health issue, they have brought in community TB workers that are going on the field to do the prevent to and screen contacts, those who come in contact with the people who already have TB. Maybe you people live together or you people are there all of the times. So that's why we are on the show this evening.
So
And most of that, there are a lot of awareness in the community with those comedians, with various communities that are burdened with TB. They are also reaching out to them on a monthly basis, weekly basis, to make sure people are educated in the community when it comes to preventing TB.
okay, so let's take it from the top of it. How does one know that he has TB?
Okay.
What are some of the signs
The
that
signs.
this, yeah.
You are coughing for more than 2 weeks, and maybe you are being treated with other antibiotics. Because many in Liberia, when people start coughing, they want to go to the drugstore. They don't want to go to the hospital, so they start to treat with antibiotics, and no, they are not responding. And you find that person sweating. That is neck sweat. The fever is persistent. It can't break, and no appetite. Sometimes the person have weight loss, so that person will come to the hospital. Or if they don't come, there are people in the field. We also have a program that we call LUMS. They work a plan. They have people working in the field facilities to also go and get people who come down with these signs and symptoms, so that we can have early prevention of people who are not come down with it yet.
Okay.
So these are signs and symptoms that we look for to do your test.
Okay.
Yeah.
So Julius and Joe, welcome to the show. We are here. We're talking. I just asked for signs and symptoms of tuberculosis. Things that people should look for to be able to go to the.
Please come in again.
So we're just
Please ask your
Yeah,
question
so
again.
I'm sorry, the phone was very low. I tried to pull it up a little bit. Will you please come back with your question?
sure.
Okay. No, I just asked for signs and symptoms of tuberculosis. Things that people should look out for to be able to go to the hospital. Now, you don't have everybody coming to the hospital. People have your community outreach. Can you explain how community people can identify who is who from Tata Center or from Redemption Hospital or whatever? How do you engage the community? Let's just put it that way.
Okay, so the first thing I want to say thank you for this platform, and let us thank you to our medical
People are
listeners out
coming
there.
in so badly.
Your audio is bad, sir.
That's a
You have to
feedback.
adjust, please.
Yeah.
Sorry,
Or if you adjust.
feedback from around you.
Miss Christina Morris also just joined us. So want to welcome you as well.
Yeah, so we were talking about the community entry. And so what we are doing, what we do is, as I speak to you, our engagement has been with, we've been working with another community partner called NEPI. NEPI is a network for community empowerment and progressive initiative.
There's a
They,
feedback. Sorry for interrupting, sir.
Yes,
There's a
music.
feedback in the back there that might cause some copyright issues for us, please.
Yes.
Yeah.
Music, there's music on.
Okay, yeah, and
Okay.
so Justina is there in case she
Justina there
can
too.
be until.
So, Miss
Just
Morris,
you can continue from there. Justina, can you hear me?
Justina, you can continue.
Okay.
Justina, you are the one that. Okay, so let's talk to Joe.
so
Okay, so Joe Binga.
Yeah.
Joe, you're following the show, so you can continue from where he left off. Community
Okay.
engagement.
So
Yeah.
yeah. Thank you very much. Thank you very much for this show, and then thank you to my colleague in there. Sorry that I'm not in person. It just due to some job engagement. In terms of what you were discussing about the community engagement, this is what we really do. We hire some other CHV along with some other panel that are already in the community, and then we move to the hard burden community, the community that we usually get more cases to come to the facility. So we identify that, and then we move there as a team, and then the team can move there well equipped. That is, there will be awareness on TB, explaining the sign and symptom. And then while we are there as well, we also go ahead when the person is showing the sign and symptom, we immediately go ahead to collect a sample, and then the sample can be sent to sometimes Redemption and also that of TB honest there in Motorado. And then you were also asking the issue of the sign and symptom. And then right now we are using this strategy when a patient showing a sign is not like cough, and then even if the cough is for 2 or 3 days, and then coupled with either a fever or cough plus either night sweat, cough plus either weight loss, and then in that case we will think that you have TB, and then we will also take a sample and also carry for testing. So these are strategies that we are also applying, and then it's also working well.
Mm-hmm.
And
Yeah,
then the issue. Yeah, come in.
no, I was gonna say I want to just thank you guys, this
Mhm.
team for working with the Liberian people to prevent something that is very prevalent in Liberia. And the message here today is that there's you guys can prevent this. You can help, decrease the rate that it spreads in the country. So that's very good. A
Mhm.
lot of people in the past thought that TB was a death sentence. Like once you have TB, your life will just be on hold. You can't, do anything. So this is why you guys are here to tell people that you guys are working very, very hard to make sure that you
Yeah.
can live, survive with TB.
Okay.
The question that uh, Miss Connor had before she left was, so how does the neighborhood know, the community, that when you guys go out, are you guys wearing a certain kind of clothes? How do you guys identify yourself so people can know that they are working with you?
Okay. So we have two groups, and
Mm-hmm.
then the first group, these are the first soldier. That is, these are just people that we train, and then we
Uh-huh.
train them in a facility, and then we send them in the community. And then
Mm-hmm.
the strategy is that when you move in the community, you go to the community chairman or the town chief and tell them
Very
that
good.
I'm working with, yeah, I'm working with the National Leprosy and TB Control Program, and then I've been trained to work in the community to also
Mm-hmm.
look for people who have the sign and symptom of TB.
Mm-hmm.
Now, at times they move either in a school or they move in a household, and then they provide that health talk. And then based upon that information, if you think you have that sign and symptom that the person is explaining, then from there you can also submit to the person that is there with you, and then the person will either cancel you and take your sample, and then we send it to the facility. Now, why in case also you don't have a TB, and then the person will also cancel you on the future or subsequent message of getting TB that today you don't have it, but then few years from now it's possible that you still come down with TB if the person who has TB is right side you. So these are the message that we are giving. And then the other one is we also carry on a jingle where
Oops, we lost you.
Okay,
Miss.
just not from him. I
yeah,
think his okay, all right, he's back.
are you there?
Yes, we are. We lost you for a second, but we are here.
Okay, so now I'm clear, right?
Yeah.
Yes.
Yes, you need to go on.
Yeah. Yeah, so and then when we move there, we do the same method, and then we will play some jingle pertaining to TB. That is the TB message, and then after that, we will ask people to come and be asking a question. That is turn on the myth or what they don't understand about TB. Then from there, the team can also provide that message, and then we will go and also situate ourselves in an area for screening purpose. And then if you think you have that message, and then you get a sign and symptom, or your relative also have that condition, then you can and tell us, and then we can also intervene. So these are things that we are doing, and now it's working really well.
Okay. So let me ask Justina one
Yeah.
question. I need you to walk me. Any of you can do it, but Justina being having signal problems. So at least we got her situated. Justina, can you hear me? Okay. So let me come right back to my team here. Can you walk me through the process from the time the person is diagnosed with tuberculosis to the time they are certified free to go on with a normal life?
Okay, when you are diagnosed, like you said, we have a test we call the gene expert. It's a farm test. The machine is the gene expert, the test is the expert. So when you are diagnosed as a TB patient, we educate you and we tell you that you'll be taking that treatment for 6 months. And we also need a treatment supporter to guide you because for a person to take treatment for even 5 days is a serious challenge. So we want a treatment supporter from that house that will guide you to take that medicine every morning, 5 or 5:30. The time is 5 or 5:30 because we want you to take the medication and enter stomach. Because when day break, you might be tempted to eat. So we say when you are still in bed, take your medication. After 1 hour, 30 minutes to 2 hours, you can find food to eat. Then we educate you those things that you should not do. Maybe your activities, if you were smoking or taking in drugs, we tells you to pull hold on those things because it might affect the drugs. Maybe you are taking excessive alcohol, we tell you to also pull hold on them and take your medication because once you are taking the medication, you will not affect other people around you. So you're going to take that treatment for 6 months, and we're going to guide you. You will go through another test. We'll go through the second month test. We'll go through the 5th month, and we'll go through the 6th month to confirm you free, and you have the certificate
Okay. So
within 6 months.
okay. So Julius, what if you get somebody who is sick, really, really sick? Not somebody who can come for the treatment and go home and this like what do you have to hospitalize people now? God, know we've been dealing with the TB annex.
Yes, so for critically ill patients that need hospitalization, we encourage the family, the relative to take them to TB Annex. This is the only hospital we have right now, the specialized hospital for TB. So those cases are referred there and they will properly manage them. But our message to the community is that if you don't want to see that people will reach to that level, because sometimes it can be hard to revive them. Okay, so we're hoping that the message will go out. People will seek, care as early as possible. The services are free. We are located through this project. We have expanded. We have kind of like increased the number of facilities from 2021. Now we have 46 facilities throughout Montevado County. For example, in all of the districts. I'm talking about Cody, Carrollsville, St. Paul River, and the Central Moravia area. So the services are available everywhere. We don't want to see people reach to that level, that bedridden stage, for the access TB treatment. So again, one of your previous questions you asked was our community entry, and we've been very strong on this. This is why we are partnering with other local community organizations and as well as the local comedians. We have some of our comedians that we are working with. Ojuku is one of them. Apparently, he's watching the show or he's listening. We take these guys out and when we get to a public neighborhood, they play, we play some music, we play some jingles, and then they come off, they make some phones in that process. A lot of people will come around. We are even using that to also share some of the brochures. To share our brochure that got a lot of information, even the list of facilities and services that are there. So yes, those are the way. But for critically ill patients, again, we encourage the family to take them to TB Annex. TB Annex is the pastoral facility for TB services in Liberia.
Absolutely.
So just not that you know, is it free? Is the treatment free? Do they have to pay any money for it at all?
They are not paying anything, and I want to say this out clear. If they got any record of payment or paying for services anywhere, they are free to contact us or inform the Ministry of Health. We have to follow up and see why they are paying. The majority of people who come down with TB are actually people from the very poor background. And that's why we even are working hard to take the services to them. Now, you understand, if you listen to one of the presenters, we are now even working with the community volunteers who are going in the homes of people who where there are TB patients that are on treatment to screen them, do the first line screening, and collect sputum from there and bring it to the facilities. Because sometimes it can be very difficult to tell somebody leave from TODI and go to TB Annex, for example, and go for TB test. as long as it's not burning them, it's not something that heavy on it. They just think that they will take some country medicine and will go. So we are trying to use another strategy by using our volunteers now to go to those people, go to those homes and investigate. And for any reason, in the process when they identify any presumptive case, they stay right there and collect the sputum, and then they bring it to the facility for testing. So we are deploying a lot of strategies to see how we can work.
Okay.
Yeah, I was gonna come in. I actually want to appreciate this community-based and preventative care. I think you guys are actually going in the right direction. I like the idea that you actually going into the community, you are connecting to the community, you are asking for the community leaders, you are
Yeah.
using, jingles and stuff like that. You kind of using preventive, like some of the strategies of preventative care because you don't want this to continue going on and for this to become a household concern. Let everybody in the country get concerned about the frequency or the prevalence of TB in the country. So you guys have mentioned the association between TB and mental health. Can you speak about that and some of what you are doing to address that issue?
Thank
Okay.
you, Doc. Okay, Joe.
Uh,
Sorry.
yeah. Okay. Yeah. So, thank you very much, Julia, and then thank you again for that last question. The uh, the issue of mental health in TB is very key because from the time past we have been experiencing that most of our patients who have been diagnosed with TB at times they suffer from depression and also that of anxiety. That is,
Mm-hmm.
they worry a lot. They worry a lot. So when they are worrying too, why is it that we are also treating them? It's also possible that they also do different things to themselves. So because of that, we thought a while to also bring in mental health activities. Now, if you have TB, what we will do is that we will use our screening tools to also screen you for mental health condition. If the anxiety is mild, we will make counsel you and then say, okay, just continue and then don't be afraid. But then if the anxiety exceeds our normal score, then from there we will also need some key intervention timely. So that's the reason why we also decide to also bring in mental health. And then it also vice versa. People who also have mental health, they also at most time also suffer from TB condition. So if you also have the mental health, we will also screen you for TB, and then if you have the sign and symptom, and then we'll also test you for TB. And then that service is being done to one facility. So you will not go to Redemption Hospital or JFK and leave from JFK and go to another facility for that same service. No. So all those services that now we are discussing is being done in one facility. So that makes it very easy for our people. And then the issue of paying your way to go to another facility for service, so now it now make it very easy with the identical strategy. Now, let me divert some more. The issue of TPT. The TPT also have two benefits that is really working well for us as a country. Now, when the person have TB, we will move to your house and then we will screen your household. Now, if somebody is in your household that also have the TB along with you, we will also help you to treat that person. And then if the TB is not also there, we will also help you to prevent you from not to get the TB in the future. So this strategy is also very better, and then it really helping our Liberian people. So these are things that
So,
we are
so
really doing.
let me hold you there a
Yeah,
bit
yeah,
and ask you. So,
yeah.
Joe,
Yeah. I'm still here.
yeah. So we've been talking about prevalence. I think it's too big a word for the people that
Yeah,
we want to reach. Especially
yeah.
knowing now that you've said that most of the people who come down with this are people, underprivileged people. Okay, so can we
Mhm.
break this down a bit so that people?
Oh,
Let me take Justina on this one. Justina, can you break it down for
no.
somebody down there to understand?
Let, let,
When
let
we
me
talk
let me
about
break it
prevalence,
down.
Yes.
or
Hel-
the
Hello.
prevalence. Let's take it
Hello.
down for the person down there to understand
Yeah.
that this thing is plenty all around. The TB
Yeah.
is
Sorry,
Yeah.
my microphone kind of low, so I'm not ready getting the
So
conversation.
okay. Okay,
okay,
that's
But we
okay.
can
okay.
Because
So So let me come in.
Joe,
My microphone
So Joe will back you up,
is
just
kind of low, so I'm not really getting the conversation.
Okay,
Yeah.
so let me break that down. Let me break the issue of the prevalence we have in Liberia. Now,
Mm-hmm.
uh, more often we hear the word prevalent, and then we get a statistic that is for Liberia we
Mm-hmm.
say is 308 per
Yeah.
100,000. Now,
Yeah.
what it mean? That mean, for example, now thank God the county meat is coming. The county meat.
Yes.
Now, if you have about 100% in on that fee,
Mm-hmm.
we expect to 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 find among that 100% about 308% among the 100% on that fee. So
100,000.
there now,
100,000.
100,000.
100,000.
yeah, yeah. So if the country meet on that fee, we have about 100% on that fee, and
100,000.
then
100,000.
yeah we expect to find about 308% to have TB among them. That is the
Wow.
simplest, yeah, that is the simplest interpretation. Or again, to real life. Yeah, to real life in our community, if you have about uh, uh, to, 200,000 to real life, we expect for about 600 and 16% to have TB among them. Yeah, so
Mm-hmm.
that is so now. Yeah, so now if we calculate per our population in Liberia, we are expect every year to diagnose about 16,000 plus among the population that we have right now in Liberia. If we do the calculation,
So how do we protect
yeah,
the wider community of people who do not have? Because people commute every day. People are in
yeah,
offices.
uh-huh.
So,
People are in school.
Yeah. So that's the reason
Why
why.
does the
That is the
wider
re-
community?
yeah.
So can
So
I
that's the
come?
reason why. Yeah. Okay, Julia, you can come in.
Thank you very much. So that we need to understand something. Hello, am I clear?
Yes, yes, we're
yes.
getting you.
Okay, Liberia. I want to just take a little bit, but then we'll come back to the statistics. Liberia is among the 30 worst. I mean, TB countries. I'm trying to say Liberia is among the 30 countries in the whole world with the highest number of TB cases globally. Yes, and this is why we are into this process. The second part I want you to know is that in Liberia, Monserrado County alone accounts for over 60% of the total cases of TB reported in Liberia. Monserrado County alone. And I will say that to tell you, as of from July last year up to now, we've been able to identify pretty close to 4,000 cases of TB in Monserrado County alone. That number is expected to really exceed to go beyond 4,000. We were in, by the end of September, we were around 3,600 and plus. So if you add October and November, then the end of December will be above 4,000 cases of TB.
So I'll
So,
put that question back to you, Julius. How
yeah,
do we protect the wider society?
good.
Yes. So,
The
yeah, Julia.
but no, there are different levels. So one, we want to be able to identify those who are actually infected with the disease, who are already ill with the disease. Identify them as quickly as possible, remove them, and treat them. That's one. Number two, we want to go back to the community in their homes. That's what we're doing now through the CHH, through the CHW, the community health workers. Go, send people now to their homes, they screen their contact, their family members, and pick up any family who got symptoms of TB. The fact that they already have been exposed to TB through their family members. Identify those people, screen them, collect spittle from, sample from them, test it. All those that will be positive, we place them on treatment as quickly as possible. In that
Yes. So,
way, we try to
Julius,
reduce the
I,
transmission.
I want. Let me ask this question in another way, maybe, so you people can pick
Okay.
it up.
All
People
right.
are confusing. People are riding the taxis, the pin pins, the kekes,
Okay.
all around the place. Do we have a vaccine for this thing here? How do we protect people? Because the number is huge. You're talking about 308 out of 100,000. That's a lot. How
In
do we
fact,
protect wider
in fact,
society?
for Colorado County, in fact, that record, that statistic, 308 is for Liberia. For Monserrato County, that is the highest burden county in Monserrato, the prevalence rate is 333. 333 per 100,000 population in Monserrato County.
In Monserrato.
In Monserrato County. But the
Let me
prevalence
just
for the corporate Liberia is 308. But for Monserrato County, that are the highest cases, we have the record at 333 by 100,000 cases. Coming back to vaccine, currently we only have
How
vaccine
are we
used
protecting the wider society?
okay, if I could come in,
now.
Yes, please.
So I come
this
back to
is where
the
we starting from.
Mhm.
Where we starting from the homes, because you're talking about we're riding cars,
Mhm.
we're meeting with our families. I just want you to know that eating together will not give you TB.
Okay.
Sleeping together will not give you TB.
All right.
Hugging will not give you TB. Except this person cough and sneeze and don't protect their nose and their mouth. That's when you get affected as a
It's
person.
airborne.
It's airborne.
Exactly.
So you're talking about the wider society. So the education will not just stop just in the community, we will carry on to the schools, in the buses, but you have to start from somewhere. Because you're talking about protecting the wider society.
So up there, do they
Okay.
have vaccines now?
Yes, so
For it that the government can go after? Because the
yes,
number is
yeah.
huge.
Yeah,
For
she's
us
talking
to,
about the
for
vaccine.
us to relax.
Yeah. So in Liberia, there are lots of ways we are trying in the health sector to prevent others who don't have TB already from not coming down with TB. And those who have TB, we try to limit the spread. One of the things that happen is when you are born, one of the first vaccines you receive once you are born, they give you the BCG. That
Yeah.
vaccine is given to help prevent the newborns from getting TB. Another thing we are doing is we are trying as much as possible to do community awareness, advocacy, teach people more what tuberculosis symptoms, signs and symptoms are. Because if you have an idea, if somebody is showing those signs and symptoms, one of the things you will do is, can't you go to the hospital, or you can go to this facility and go and check yourself? Because if you go there and check yourself, if you are diagnosed early and treated properly, what happens is you get well. Another thing is it will help curtail, it will help stop the spread in the community. What happens is, even if you come to seek treatment, as she said, as my colleague said, Tracy, we ask for a treatment supporter. So that person in the process while the clients or that particular suspected case, the person comes to the clinic, you are counseling them. While you are seeing them, you continue to counsel them, you educate them, and those treatment supporters that come along with the person, you also educate them what to do. So if you follow those means, especially with the initiation now of the TPT, because the essence of the TPT is, yeah, I'm Mona. I came down with TB. Me and Tracy, we live in the same room, or we live in the same house. We are always interacting. What happens? Before I could go to the hospital to get tested for TB, Tracy and myself was interacting. And TB is airborne. Once I speak here, I have TB. The particles leaving my mouth, it goes out in the air. And those particles stay in the air for a certain period of time. So when she comes in contact with it, because for TB, we have vulnerable people who can easily come down with TB. So that's the reason why the TBT is brought in. So if I'm down with TB and she has been interacting with me, what happens is we go to contact tracing. We trace the contacts of those people who are down with TB, who are sick with TB. Once we get to those contacts, we screen them. When we screen them, anybody presenting signs and symptoms, then we do diagnosis, test, and treatment. But if you don't have any sign of symptom of TB, what we will do next is put you on a preventive therapy to help people around you and help people in the community.
Now, Richardson, the thing is alarming.
Yeah.
I don't know why it's this the awareness is kind of low, hearing these kind of figures, 300 and plus out of 100,000.
Yes, the
Well,
reason we have
this team is actually doing very well. TB has been an long problem in Liberia and in Africa. You have countries like Namibia, South Africa, and Central Republic of Africa, of Central Republic of Africa. So these countries have TB as well, and Liberia happens to just have plenty. Like to not use the word prevalent anymore, plenty. And so I like the approach that this team is using. It involves you got to be able to go out into the community. It almost reminds me of the COVID approach,
Yeah.
or the Ebola approach. But I have my concern. Obviously, that my specialty is in mental health. Basically, let's talk about symptoms of. You told us the symptoms of TB already. Tell me some of the symptoms that somebody with TB who might also have some mental health issues. And you already told me how you address them, but let's talk about that person who might have a comorbidity of mental health and TB together.
Okay, so let me come a little bit. And
Okay.
so it will interest you that to know that to know that there are patients who are identified as having TB, and while they are placed on treatment, all of a sudden they just disappear. To come for the appointment, it becomes difficult. The clinicians are finding it, I mean, we're finding it hard to get them.
Okay,
On the
so
note,
one is isolation. They tend to isolate, or
they
sometimes they
tend
kill
to
themselves.
isolate themselves. They tend to isolate themselves.
Okay,
Out of For one, it could be out of fear of stigma, discrimination,
that's
or
right.
and the
Mhm.
stigma can be self stigma. It can be the community side of the stigma.
Okay.
So if the person is mentally, or is psychologically taken care of, or mentally, prepared,
Yes.
they will not want to drop the treatment. They will see it as an opportunity. But
Yeah.
on the
Mhm.
other hand, you see that the person is missing their dates. They're not coming. I mean,
Okay.
sometimes you go to them, they're not coming. That's a sign.
Okay.
Number two, you see a person with TB when you do the screening, the mental health screening. We're using the
Mhm.
PhD now to screen for depression.
Okay.
Okay? Using the GAD7, using the
So some
case.
of those
Using
some of those
the
symptoms could be your lack of appetite. You don't want to eat. You telling
exactly.
us you tend to
No,
isolate. You sad.
absolutely.
You
It doesn't
worrying a
anything.
lot.
Exactly. Those
Yes.
are the signs that we see, those are the signs we know that the person, though they got TB, but they have gone into mental illness, into mental crisis, mental health crisis.
So on the TV side, they will be coughing plenty. They'll
They'll
be
be,
sweating plenty. And on the mental
and,
health side, they'll be
yeah,
like they won't talk to nobody. They sad. They crying. They're
yeah.
worrying.
Someone there will even be smoking or just drinking excessively, more
Aha.
than that, more. Yeah, just excessive drinking now.
Right.
Because
Uh-huh.
they just got no hope. They think they got no hope.
Mm-hmm. But I want to
Yeah.
also add
So
this because one of you guys mentioned that you guys know our country as well. There are people there who are mentally ill, and one of you guys mentioned that among that population, TB tends to run high because they are mentally ill. They are not taking care of themselves. Uh, they don't even sometimes know that they have TB. So, what are you guys doing? Are you guys going to that population as well?
In
yeah,
fact,
okay. So,
this project is partnering with a group called the CFUH. CFUH is Contribution for Use of Hope. One of them should have been on, I mean, should be online with us. Bala should be online with us. These are people who have suffered from mental illness or different forms of mental conditions, and they are in what we call recovery. So our project brought them on board, and we have been able to screen them, and then for any case that we identify, we send them for treatment. Besides that, we are also working with Grand Hospital, ES Grand Hospital.
Yeah,
Before this project, there was no screening for TB
thank
done at
God
that
for that.
facility. So today, we are screening everybody that entering that facility through this project. That's
Mhm.
one benefit of the project. Besides that, we also targeted the at-risk youth. With the at-risk youth, we have been able to screen over 1,000 of the at-risk youth, and we found some TB cases among them. As I speak to you, those people are in here.
Mhm.
So how
Yeah.
many
So,
schools are you people in now?
say that.
Have you started going to the schools to create awareness?
Okay, yeah, okay. Yes, the answer is yes. The National Leprosy and TB Control Program, on a quarterly basis, we select a school in Motorado and also in environment, and then we go and also provide a scene TB medicine, and then we sample start through the ministry of education, and then they can also help us in the process, and then we can go there and also provide some TB message. And then I think what Judah was saying pertaining to the answer that he was giving pertaining to what are we doing in terms of responding to our mental health client.
Mm-hmm.
Uh, what what we did along with Kada Center is that we train all the mental health clinicians in Liberia, meaning in Motorado,
Mm-hmm.
on TB. We train all the mental health clinicians in Motorado on TB, and then we also train all the TB clinicians also on mental health. So, so it make it very easier that the TB clinician will have knowledge on mental health, and then the mental health clinician will also have knowledge on TB. So it make it very easy, as they mentioned about Grand Hospital and other hospital in Mosurado. So these are things that we are doing, and then it's also yielding a good result for us as a country.
So what kind of
So
cough?
my
What
question,
kind of
I
cough
have a
should we
question, Miss
look
D.
out for? Should we feel? What kind of cough should we look out for? Whether that cough with phlegm or dry cough or what? Because
Okay, so
if we identify what kind of cough that is, if somebody is coughing, yeah, if somebody is coughing around you,
So
you
once
already
you are
tell them,
well,
okay,
coughing for 2, 3 days,
so
I know people with
yes,
asthma will cough to
yeah,
clear
no,
their
it
throats
doesn't
and stuff like
matter
that.
the type of
So,
cough,
oh,
but
it
we
doesn't
want to
matter.
test that cough.
Oh,
Once
they,
you
Yeah,
are
they check
able
it.
to
yeah,
produce,
produce
once you
that.
are able to produce the cough, we can test the cough.
Yeah.
Okay.
So we carry it to the gene expert machine and do the test and test it, because with the gene expert machine, what it does is it picks up the DNA of the bacteria that causes tuberculosis. So that's what happens. So once you are able to produce a cough, we take it.
Because back in the day, the old people say you had a person coughing, then somebody coughing like a cough.
So whether
Those
it
are all
brown,
myths.
it green,
Yeah, whatever.
it doesn't matter.
Yeah.
So I have a
so
question. So
yeah.
how do you, because I heard one of you guys say, which is an excellent preventative care, that many of the babies are given the vaccination when they're born, right? So
Mm.
we know that sometimes when you take the vaccination and you get tested in the future for TB, you can get a false positive.
Yeah.
Is that part of your education plan? Because a lot of us who were born in Liberia who had that TB vaccination when we were young, when we travel around the world and we have to get TB tested, we do come up positive. So is that part of your education plan to let people know, and what can they do when they come up positive? I know the chest
Okay,
X-ray we do here.
okay.
Yes, ma'am.
Okay, my colleague that in studio they will come in, but then let me also explain in terms of let me also add on in terms of the issue of the vaccine.
Yes.
The
Yeah, God, we missing. He went
Oh,
off.
okay. So
the
while we're
child
waiting
the
for
vaccine.
Okay, you back?
Hello.
Yes, you're back.
Yeah. Yeah. So the person will take the vaccine, and then in the future or going along, the person will stay calm down with TB. And then some of the factors, sometimes it can be the mother refusal to also go by the schedule that they give it to them at that time. One factor. And then another factor is that when a person immune is not strong to
Yes.
battle the disease, the person will
Yes.
stay calm down. For example, I took the vaccine, and then
Okay.
I'm now coming off. I'm now coming off. And then I contract diabetes. I contract HIV.
Yes. Your
And
immune
then
system.
I'm
Hmm.
yeah. So my immune system it will not be too strong equal to a person who don't have also HIV.
That's correct. Yes.
and so that is it.
So what I'm
That
hearing,
I
I'm
took the
sorry,
vaccine and
so can I ask you guys? So are you? Am I hearing you guys tell the public and also tell me that even though you can
so
take the
so, so
vaccine, but
mhm.
you can also come down with
Yeah.
the TB symptoms in the future.
Yeah,
That's correct.
exactly.
Okay. So do you guys? I
Yeah.
heard you also say that if the mother does not follow the scheduling of the vaccine,
Mhm,
is that
mhm.
what is the scheduling of the vaccine? What does that entail? Because I mean I was young when I took it. I think I took one shot. Is there more than one shot that you're supposed to take?
Yeah. So the
Okay, so
BCG, sorry, Joe. The BCG is given through IM. I mean, through the IM group for
Yes.
now,
Okay. Yes.
until they will change it. And so,
Mm-hmm.
but I think what Joe is saying is that we have time frame for the BCG when the child is born. And
Mm-hmm.
and sometimes, I mean, I don't want to sorry, we have a good health system, we got a very strong health system. So
Yes.
sometimes these children actually can come after the period for that
Yes.
vaccine.
Okay.
Okay, and sometimes they give it, and then we have the impression that the child is fully immunized. But on
Yes.
the contrary, it can be the case. That's one. Two, like Joe also mentioned, and let's not also forget the reason why one of the reasons why we are even among the highest burden TB countries in
Uh-huh.
the world is because we also have a lot of HIV cases in Liberia.
Correct.
And HIV and TB is the number one, is the opportunistic, infection in HIV.
That's correct.
So yeah, so these are some of the factors. Okay, so once the person is coming, although they were immunized against tuberculosis when they were small, but at some
Mm-hmm.
point in time they come down with HIV or they come down with let's say
Affecting the immune
malnutrition.
system.
uh,
Yes.
the immunity becomes weakened. In that
Yes.
case, the TB will seek that opportunity. That's why it is called an opportunistic infection. It will see
Correct.
that as an opportunity and will come out. So vaccine is not 100% surety that you will never get TB again in your lifetime. No,
Great. Thanks
that's
for
not the
saying
case.
that. Thanks for
Yeah.
clarifying that. So, do you guys have different departments? Because this sounds like a big, a big illness to tackle. Because I'm hearing tuberculosis and TB, tuberculosis, depression, tuberculosis, anxiety, tuberculosis, and diabetes. So that's a big. Do you guys have different departments, or is it just all in one big department? I'm coming to see you guys at the Carter Center. In fact, where do people come? I know the NX, the TB NX. Is it a Carter Center? Where do people come if they will need to come and see you, or you guys will give them
Uh,
recommendations?
Okay.
okay,
So
so yeah, so mhm. Y- yeah, go
so
ahead, Johnson.
it's not only TB annex.
Okay.
We have smaller clinics
Uh huh.
that are providing TB services exclusively. But
Okay.
also in the hospitals, they
Mm-hmm.
have doctors, they have nurses, and even some hospitals have
Thank God.
special units that are
Yes.
providing TB services. So if a patient comes to the hospital, for instance, I'm diabetic, I came to the hospital to
Mm-hmm.
seek diabetic treatment. But
Mm-hmm.
during the screening process, they
Mm-hmm.
notice that there are signs and symptoms of a suspected TB case. What happens is if that hospital has a special unit for TB, the patient
Mm-hmm.
is sent to that special unit where the patient is further screened, diagnosed, tested, and then, if positive, the patient gets on treatment.
Mm-hmm.
That's what it's
Okay,
doing. So
so
it's not only in those 46 facilities, but even in the hospital settings, the patients are also screened and tested for TB.
Mm-hmm.
Well,
Right. So
okay,
let me
so
just go.
yeah,
So,
So
so
big deal.
okay, go ahead. I'm sorry. I just wanted to go to our
yeah,
viewers. Some of them have questions. I just want us to go through the questions because the
yeah, so
right.
atmosphere
yeah, yeah,
of this
yeah. So
program.
let me
So
provide some. Let me do. Let me do addition. Then from there, the question that is there, it will be asked. The,
Just they like for the calls on, and then we can be discussing.
We don't have
yeah.
much time.
So Joe, can I just say
yeah.
something quickly? Then you come in.
Okay.
Let me make this point very clear.
We not place the calls through. Then we can continue. Then you can pick up from there.
And so
Okay.
to our
Okay.
listeners, in case you're part of the show, you want to ask questions, you need to know more, just call on 077771075 or 055510105. I will still have the numbers scrolling in case you're watching via Spoon TV Live.
Okay.
So,
So
Okay.
back to I want to make this point very clear.
uh huh.
Uh, that the Qatar Center's role in this project, Qatar Center is not a hospital. Qatar
Okay.
Center has been in Liberia here for over 10, 14 years,
Thank you.
supporting the Ministry of Health. Qatar
Yes.
Center is a support arm to the Ministry of Health, particularly in the area of mental health. Mental health. They've been
Yes.
focused, particularly with the Ministry of Health in mental health.
Good.
This time around, we are now integrating mental health services into TB and into other chronic illnesses like NTD.
Okay.
So the Carter Center is, is just partnering with the Ministry of Health and making sure that we get the funding out there and provide support to the ministry to help the
Okay, as
Liberian
we
people.
wait for the caller, and Lorraine, please cue me in if there's a caller. Okay, so you are saying, and what I'm hearing you say that if someone is experiencing TB and someone will come or someone comes to the community, they will tell you exactly where to go. They will be able to work with you. But if you don't get a community person, a community worker to come and tell you where to go, then where do you go?
So we have lists of facilities,
But if
lists of
I don't if I don't get
facilities.
a community person to come and work with me, like I understood you at first, which is great, is the community plan. You guys are making sure that you track, you following people, you going out into the community, you doing awareness and everything. So if I'm in a community and nobody came to my community because I way down somewhere in Johnsonville.
Okay. Okay, I mean, I know you wanted to lay some of the facilities. So in Johnsonville, for example, you have the Johnsonville Clinic. We got three
Okay.
staff there, got services that are provided there. You got
That's good.
the Mount Barkley Clinic around there. Also got St. Benedict Many Clinic, a health center right on the Puebla there. You also
Good.
have the Puebla Health Center right around Red Light. And you got so the facilities are spread across Mosovado County. Let's assume that you were in Todi. You got a
Yes.
Boba you got a Boba Town Clinic, you got a Yang Health Center, you got Poon Town, you got Zena Town, you got Yimba Clinic.
Oh,
Those
thank you.
facilities are totally providing services, free TB services. If you are in Kingsbury, for example, you got a Kingsbury Clinic right to the checkpoint there. You got even the clinic in the military barrack can send you where. We also train some soldiers. They are also providing services, TB services
So,
and integrated
so
services.
Liberians, if you're listening, we just heard from the TB team here in the studio, and they're telling us that they have really worked so hard in making sure that they bring awareness. They bring awareness to you. They have different clinics in the different communities that you live in. If you're feeling sick, you have TB, be it TB or mental health, just go to one of the clinics that's nearby, and somebody will direct you to how to address. Okay. You got a call, Lorraine? Lorena?
Yeah, we had a call coming in, but it's off. So you can call and be on the show, 077771075 or 055510175. We also have the numbers scrolling. Okay, we have the first caller that I can get through. Hello. Good evening.
Hello.
Yeah, good evening. Welcome to Spoon Talk Business.
Yeah, thank you so much. Uh,
Tell us your
Thank
name
you.
and yeah.
My name is Giflog Banner. I'm calling from Johnsonville area.
Go ahead, sir.
Yeah, one of your studio guests, Julius Nagawala, and myself, we work together on a TV program. There's just one important thing I just wanted to stress. You guys are giving me very good information, but there's a point that Julius was about to stress, and like he was just a little breached. But it's good to mention about the issue that the leader asks about how you prevent the greater population. And the simple thing the greater population is to break the chain of infection. Like he mentioned, once you can get active case TB from the community first and put them on treatment, you reduce the infection rate from the person infected to the person who is not infected. And then another thing is that someone must breathe into their lungs. When we're talking about pulmonary TB, they must breathe into their lungs.
So I want to emphasize the point that he is saying. And I think you guys said, okay, go ahead. Lorena, go ahead. Take your call.
Hello? Good evening. Good evening. Okay, Doc, go ahead.
So he's saying, like, I think I heard this before, that even though TB is airborne, but someone must actually breathe on you or cough on you. Is that what I heard him say?
Yeah, like
That thing to the
Yeah.
lungs.
If you breathe it into the lungs.
we have
But the
another caller.
particles,
Yeah, the
as the person is
particles,
talking,
yeah.
the
You
particles
must
are.
breathe it in.
We have a
Because when
caller
I,
on the
Once
line.
they're in the air,
yes.
it's airborne.
Hello, good evening.
Okay, I
Yeah,
hear you.
good evening. How you doing, man?
I'm okay. Welcome to Spoon Talk Business. What is your name and what is your issue?
My name is Jerry M. Cameron. I joined from Rehab Chicota.
Okay, make your point.
I have a specific question when it comes to mental health. I want to know whether if a person suffering from mental health can fully recover if they're taking their treatment.
Thank you.
Or from what? The mental health or the TB?
A mental health patient that has TB.
Yeah.
Not TB now. I don't know whether I'm talking about mental health. For
Yes, they're looking at the
example,
mental health aspect of people with
huh?
tuberculosis.
We're taking note of the questions.
No.
Okay,
All
I
right,
thought
so
we
they,
were
they,
hearing
they,
it.
they are listening, they will answer, okay? All right, 077771075 or 05551010075. I don't know if Justina can come in now before we close the show while we still with some calls. Justina, the host, have been asking you, but you haven't been able to come through. Can you hear me? Justina, are you hearing me? Okay, then Justina, it is from your end. Because others are not in studio, but they can get us.
Yeah.
077771075 or 05551010075. Good evening.
Hello,
Yes, welcome to the show.
I'm James B. Richards, calling from Dillamore Open Perspective.
Oh, the line is off. I don't know what's going on. 077771075 05551010075. You ladies can go ahead. We'll have calls. I will signal you.
Yeah, so hearing all this, I just want to talk to our Liberian people who quick to take things for granted. These people are not leaving their homes, going in the street, going from community to community, creating awareness because they don't have work to do. This thing is serious. Don't be that the man bluffing, he got leprosy, he eating his fingers instead of going for treatment. He shove it in his pocket and he walking and the thing eating him day by day, day by day, day by day.
All right, there's another
Another color.
Yeah, good evening. Good evening. All right, let's take this one. Good evening.
Hello?
Yes, you're live on the show, sir. What's your name? Where are you
Yeah,
calling from?
this is Gayflow. Once I was calling my Lone Star to Orange. That why I went off.
Okay.
Yeah, like I was saying, one of the best way to help prevent the greater population is to make sure the active case finding is effective and getting out infected cases from the community onto treatment. That also breaks the chain of the contagiousness of the disease. Another thing is like we mentioned, TB is not easily gotten except the person breathes the bacillus into their lungs. Then there's a difference between getting infected with TB and coming down with the disease. You can be infected and not diseased because most of the time the bacillus move around, people get infected with it. But if you got immunity stronger, they can fight the bacillus and kill it, and the person does not get diseased. So that's why you see people who have TB, they live with the people who don't have TB for some long time. When you go there, even you test them over and over, you screen them, they still don't have TB because the immunity they have is preventing them from coming down with the condition. So those are other things. But then one important thing I just wanted to stress, the opportunistic infection that also making TB prevalent in some of the people is HIV.
Yes.
You know, the HIV population is another population where you easily get TB because of the low immunity. So, like they mentioned, screening mental health cases for TB. There's also there's also a protocol that every HIV patient must be screened for TB and TB for HIV, so that you can also get people who have low immunity and also have the opportunistic infection. So those are the few things I wanted to stress. And my brother Julius there is an expert on it. Somebody else in the program. He knows most of the issues. Thank you.
Thank you. Thank you.
771075. There were calls coming in while he was on. Let's take this caller. Good evening. We'll take two more calls.
So somebody asked about
Yeah,
that is
your
something.
name. Yeah, you address all of the issues, the questions. Good evening, sir.
Yeah, good evening. How you
Yeah,
doing? Good
I'm
evening,
okay. Your
bro.
name, where you calling from, and then straight to the point, please. You have been following the show.
My name is Alfredo P. Dam. I'm calling from Single.
Go ahead.
Um, yeah, that is a brilliant discussion. At least people will be informed, will be educated about it. But the issue about TV, we need to know. We got two types of TV. We got extra preliminary TV and we got preliminary TV. Extra preliminary TV lives in the boom. More often we diagnose it through antibody testing. Then the preliminary TV lays in the lung and we also diagnose it through the carbon fuzzy and also the gene expert machine. But the thing I was solving for it in laboratory is that what making all the things spreading and we're not eradicating it is that there is no setup for us to be able to adequately or effectively diagnose people are living with a condition in the community. Because if even government like that trying to help, that other NGOs supply the gene expert machine that we can use to diagnose the TV, the cartridge can't be enough to serve the public. And so on the machine, when the machine breaks down, then the entire country is up. Nobody will be doing that test. Because to do it manually is a long procedure. To do it manually is a long procedure, and you got to do it three different samples to even confirm that the person get TV. So if we discuss it, I think we need to contact the way forward. We think we can set up a system that will it will be very, very effective in diagnosing the problem. Because in any case, when you solve the problem, when you do a test, if test is negative, the investigation continues. But when you do a test, the test is positive, the investigation ain't right there, then you're looking for solution now.
Thank you so much,
So
sir.
if
Okay, I just want to add to
we
you.
need to solve the problem, let's make sure help well with other local clinic, private clinic, government clinic, because not everybody that will go to public area to explain their problem and set up a unit, a team, and supply, monitor, and put a trained staff there. Because if you get this department there, you don't get a trained laboratory technician to work there, and you will not take a quality result.
Thank you, sir.
Yeah, let me just add to
Thank
him.
you very much.
That would be
Yeah,
our
thank,
that would be
Yeah,
our
that's all.
last
yes,
call for tonight because we're almost out of time
Yeah,
yes,
we are out of time.
now. So we'll take you in
yeah,
responding to that. You make your parting comment.
yeah.
Anything else that we have not discussed tonight, you can come up with that. And for all the questions that they asked, one person can address those questions so that we can zoom out.
Yeah, pertaining the information that is given the public about the gene expert testing, where you have to carry 3 samples, is not true.
Okay.
The gene expert testing will carry 1 sample.
Thank you.
So where he even giving the public information that we don't have a trained laboratory technician is false. Like Julia said, we had 21 centers, and now we have increased to 46 centers just in Maserati. So the information is given the public now is wrong. So I beg you,
Okay,
let
so
him
yeah,
prove when it comes to
okay,
TV
yeah,
stuff in Liberia.
Somebody is asking here whether let me just do this one thing. The person says, is Alson Sabah. So I don't think that the Richardson's remarks were addressed. He says, in America, if a Liberian that took the vaccine as a child and tested in the US, the results are positive, but when the X-ray is far up, it becomes negative. Now, is X-ray a part of your process?
Okay. So Dr.
yeah,
Richardson actually talked about a false positive, and that is the case of latent TB. Somebody tried to talk about it. When you are given a vaccine,
What is the latent TB?
yeah, that's what I'm coming to talk about. Once you are given a vaccine, that dead portion of the TB bacillus has been injected into
What's
you.
bacillus?
Okay, it's what causes TB. Yes, that tiny, tiny things we are not seeing. What causes TB is in you. So once it's in you, it's there permanently. What happens is, yes. So what happens is if you come in contact with the infection, it's possible that you come down with TB disease. So having that bacillus in you, it can be in you and not making you sick. That is latent TB. So he mentioned something about doing the chest X-ray. Normally, we don't use the chest X-ray as a diagnostic tool in Liberia. Even though sometimes, if you're presenting clinical signs and symptoms, the chest X-ray can be added as an investigative tool, but they don't rely solely on the chest X-ray to diagnose you of tuberculosis.
Okay, so let me come in again. Thank you very much, Johnson, along with Tracy there in studio. The to add on to in terms of the system we have in Liberia, every country have their own system of treating TB. That is the machine they use to even detect TB. So for Liberia, we agree upon using microscope and also that of gene expert. So other country they even use a different machine like even lamb. If you use the urine line and then when you find TB inside or even the skin test and you find TB, you will treat. But then for us here in Liberia, the diagnostic method we have first is gene expert and then the second one is also that of microscope. And then the other colleague that also said we don't have trained people in Liberia. These are some
But
of our problems
that
for
that's
us.
already, and because we are
And,
out of time, we are
yes.
out of time. So you are making
Okay.
your parting comment right now. So just
Yeah.
on a
Yeah.
1 minute, hit it.
Okay, okay, so thank you very much for that. We said we have trained people in Liberia. Almost all the hospitals in Liberia, we have trained people to also detect TB, to also talk about TB. They are well trained. We train them. They are all professional people, and then they are available to also give you a service. In terms of the machine to use to test you for TB, we have so many facilities in Mosorado, even there, and also outside of Mosorado. Another thing is when you have the sign symptom, please go to the facility and then let the facility also help you to detect your condition. Thank you very much, Dad, for also supporting us. And then we will still be around. And then any information you want about TB, we will still provide as we go forward. Thank you very much. Joe Bianga from TB Program, Ministry of Health.
Thank you, Video.
So let's move to Justina. Justina, your parting comments. All day we haven't been here to get you. Now we got
Yeah.
you now, but you're saying goodbye. So your parting comments.
Once again, we want to say a very big thank you to your studio for the opportunity given us to talk broadly on TV. So what I want to say, my parting comment is about this contact tracing. People out there should be encouraged to do this contact tracing because it helps to. It's a critical component of the TB control program worldwide because it supports a broader goal of reducing TB incident and prevent outbreaks. So we are encouraging people to please allow the CHVs that are going out there to allow them to do the contact tracing. And I want to say a very big thank you to all of my guests because my microphone been giving me a hard time, so I could not get into the talk show. So thank you for now.
Okay, that's not thank you, Julius. Let's thank you.
So, my parting statement to our community people, we're begging you, we got your sons and daughters that we already hired for 2 months. There's November and December. They are going around. They're not just going to whom to because they just want to visit there. They're going there because apparently there is a patient who gave address, say, I live in this community. And so we gave them those addresses. They are going there to talk to you about TB, screen some of your relatives, some of the other people. I beg you, just allow them, work with them. They come to help you. So that because many times you don't have money to pay your way, come to the clinic for all the tests to be done. So when they screen you and they know that you got some sign that look like TB, they will ask you for cough. Please cooperate with them. Give them the cough, they will carry it to the test, to the facility, they will check it. If you have TB, they will call you and place you on treatment right in your community, right beside you. It's not like before now where you got to travel far off. So we're begging you. We are getting feedback from the community volunteers that many of the numbers they call in, the people are telling them no, they're not me. When they go to the community, they go to the hospital to talk to the people, to screen them, they say, we don't know about you people. Who say you can't talk to us? So please, we're begging you. You allow your sons and daughters to work with us, to work with people so we can help you. I'm sorry, yeah? That's my parting statement.
Thank you, Julius. So coming back to the two studio, because the two giants that made it here. So let's go. Let's take your parting comments.
Yeah, for me, I want to say thank you very much for the opportunity given us. And you are saying, how do we handle the general population? The the awareness in the studio now is one way that we are handling the
So it's
population.
supposed to be frequent.
Yes.
Yes.
And so we want to say thank you. We know not many persons will listen, but we know the number that will listen will help. And with the community awareness and with a strong team, we have people who have been in the system for like 10 to 12, some of us 13 to 14 years experience. And by the grace of God, we are moving forward to make sure that we end TB in Liberia. But with the help of the entire country, especially our less fortunate youth that is making TB the hearing be increased. We
Rampant.
also talking to them as we go into the community, let them listen to us so that we can collect the hospital and call them to the community, to the facility to get on the treatment. Thank you very much.
Okay. So I want to say thank you to Dr. Richardson and others at Spoon who were able to work with us to have this program. And I want to reach out to community members, those who are ill, community leadership, and all of that. We are begging you people. We cannot do this alone. It is not possible for us to end TB if only clinicians are doing the work. We can end TB if we work together. So if the CHVs are coming into the community, they are reaching out to you, please work along with them. Give them the opportunity of talking to those who are coming in contact with you, because people who come in contact with you will come in contact with the disease, and it's possible that an entire family can come down with TB. Please don't be ashamed. TB is not a death sentence. Anybody can get TB, and once you get early early testing and treatment, you can get well and save a lot of people. We thank you all for listening to us.
Yes.
Okay. So that's it from all of you. I'd like to say
Yes.
thank you for coming. Thank you for the program. Thank you for the work you're doing out there. And our community people, I was telling you the story about the leprosy man who put his hands in his pocket until all his fingers, the thing ate everything. TB, that way back, they used to call it consumption, call it this, call it that. It is not a death sentence anymore. And don't feel that you too, because they talk about the underprivileged people get it. It doesn't mean that if you're not underprivileged, you can get it. So we all gotta be our brothers' keepers, and we have to fight to make the numbers are not good for Liberia. Plain talk, Dr. Richardson, the numbers are not good for us. So we all have to fight. Community leaders, that's what the people are saying. When the people come in your community, try to help so they can reach the places they're in the place that they would not normally go. Okay? And if you have it, please carry your handkerchief if you have to go anywhere when you cough into your handkerchief. Don't just cough into the air like that because somebody might get it. Okay? In as much as you could, when you're taking the treatment, if you go in and the people treating you, already it will be hard for you to pass it on, right? It will
Yes.
be hard for you to pass it on. So go in. Don't be ashamed. Sickness, not sickness. It's better for you to treat yourself than for you to die early. With that, Dr. Richardson, I'll let you pass
Yeah,
it back.
I just want to say a big kudos to, Miss Lorena, honoring you, to Miss Titi, and also to the team that came to talk about TB today. All of you guys, your remarks were significant. It helped greatly. I would love to have this conversation often because you guys know this type of awareness goes a long way to preventing TB. So I want to just tell you guys, thank you so much for your hard work. And my Liberian people, y'all, please, when the people come, y'all listen to what they have to say. It takes every one of us in Liberia to decrease the rate, the plenty TB that we got in our country. All right. And the people talk about, the HIV too is there. That one makes it harder. So I want to just, y'all please come, y'all you can't be talking here plenty and to other places. Y'all should do it more often so that our people can know. All right. So thank you so much for being here today.
Okay, Lorena, as we transition, so that I just need to go get ready for
Yeah, I'm
spoon
going.
talk
I'll
tonight.
see you guys. Let me get ready for a spoon tonight. See ya later. Thank
All
you.
right. Okay, bye bye. All right, and we'll also say goodbye to the guest, CEO Titi. Can you still hanging with me?
No, I'm hanging with you, man. I'm going. You hanging by yourself tonight.
Okay, that CEO, yeah. So I'm alone here, close on the show. We say so many thanks to the team, Spoon Talk Business team, and all of you that have been there watching, listening. Remember, this program is in partnership with Carter Center, Stop TB Partnership, UNOPS, and other partners. So if you are there and you know of any member of your family or someone in your community that might be having or coming down with symptoms where it concerns TB, please make sure to reach them, all of those that were here to help you save a household, a community, and even your own life. My name is Lorena Honorary. This show returns next Friday, 6 o'clock. We might have some, emergency shows within days and weeks. So don't be surprised. Spoon Talk Business returns next Friday, of course. And you being there, just keep following Spoon TV. Spoon Talk comes on very, very soon.